Hello, today I'm going to talk about coercion. First and foremost, what is meant by the word coercion? Coercion is defined as the method of forcing someone to do against their own will in order to do what you want. It is used normally amongst criminals because they tend to force their victims to do what they want for their illegal crimes. But this time we are dealing against patients, so it's kind of a different situation. So for medical purposes, coercion is used, for example, during administration of medicine on the patients. Whether they like it or not, they had to take it. So it's kind of a job for the nurses to force them to take. But we know that forcing is kind of an aggressive, and in that sense, it's more of an abuse to the patient, so it's not good. So for the best way to do coercion is to ask for them for their cooperation, whether to persuade them in any way possible. As long as you get the cooperation, then coercion can be done without any aggression whatsoever. So you're kind of forcing them to take, but also they are letting you force them to take. Yeah, it's kind of a nice thing to come. To talk about situational task 1. So this is the statement on the screen. And now the questions. Question 1. Miss Grigorova cannot feed herself or ambulate. What kind of assistance will she need after discharge? Well, since Miss Grigorova cannot feed herself or even move, it is best to recommend her to stay with her family members or any friends, if she had one, in order for her to gain any sort of assistance when she needs some help. Second question. Can she be discharged to her apartment, living alone? Explain your answer. Being discharged can also be meant by your ability to take care of yourselves without the supervision of any healthcare workers while you continue to recover. Looking at the situation for Miss Grigorova, she lives alone in her apartment and her injuries are yet to recover. So the chances for her to be discharged is really slim. Can she be discharged? Yes, but it is not recommended to do so. Final question. List the locations in which her continuing care could be provided. Her care can be further provided either if she goes to a clinic, or she could also stay in the hospital with the care of the nurses. There are special rooms for people like her to continue without even being discharged. So yeah.